aligned. Cause it shouldn't hurt to smile when your bite is aligned. The Numbness Center, taking the bite out of pain. The Numbness Center, what lies behind every smile is how your bite is aligned. Cause it shouldn't hurt to smile when your bite is aligned. You're feeling fine. The Numbness Center, taking the bite out of pain.
With the teeth apart prior to coming together, this is where the teeth come together first, just like closing a door. This is with the teeth completely together, what we usually call bite. These are CT scan views of the TM joint showing the condyle jammed in the back. This is a view of the jaw with the mouth open showing both condyles are coming out of the socket, called subluxation. Same thing shown differently in a 3D view where the joint is coming out of the socket on both sides. This is the right side, earlier one is the left side. The next one has to do with the listening to the joint, recording the joint noise or vibration, and checking the frequency. The higher frequency shows bone rubbing against bone. That is the higher frequency after lower frequencies have been filtered out. This is part of the posture analysis, showing the eyes are not level, showing the shoulders are not level, and also looking at the back, the spine is not straight. The side view shows a forced posture. The ear is lined up with the shoulder, but he's forcing it. Once I asked him to be comfortable, this is how far back he wants to go, where it's comfortable. The next one shows restricted airway. We're measuring the pharyngeal airway, not enough room because tongue doesn't have enough room. This is a forced posture again, bringing his head up. If you look at the whole body, this is how he is forcing all day long, using the muscles to have a better posture. You can also see on the back where the shoulder muscles are constantly working to bring the scapula towards each other. Again, this is where he's feeling comfortable. When he's not putting a lot of effort, this is where he goes. The next part has to do with the posture analysis using Posture Pro program. This one shows where there is additional strain in various parts of the neck and lower back.
Walk towards us normal
This
speed.
is a gait analysis.
Normal speed.
Basically looking at how he walks at a normal speed and then also at a faster speed. He is leaning
Okay,
to
sir.
one side.
Walk back
arms
normal
out,
speed.
You can see. And shoulders are not level either.
Both feet are out, right shoulder way down.
It's like looking at a car that is moving, if it is pulling to one side or the other.
All right, sir.
The next one has to do with the function of the jaw. In other words, is able to put additional adequate pressure when he's chewing food. Before he didn't have much, but after relaxation of the jaw he did. This is opening and closing, measuring. This is jaw tracking to see how the jaw opens and closes before and after relaxation. The next image shows an example. This is not Kyler. Show an example of the devices we use for jaw tracking and measuring the muscles. These are the muscles that are measured to see at various conditions: temporalis, masseter, SCM, and then under the jaw. This is at rest. Ideally, the jaw should be much calmer than this, jaw muscles. Here shows the amount of effort it takes just to put the teeth together. It should be effortless. The next image shows the percentage of effort it takes just to get the teeth together.
What you just said, Kyler? I just turned on the tents for a little bit. You said something.
Yeah, it's like, you guys can send me out of here right now. I'll pay. I'm done.
Why?
I mean, I've never had this visual clarity in my eyes. It feels like in my entire life.
Huh.
Like it feels like you've lifted a fog out of my visual perception. The tense problems all in here, the pain, the chronic pain, and just it's this nerve fog has been like lifted. It's unbelievable.
Because right before you started,
Like-
you're feeling what?
Just a migraine. It was right here, an aura, a big blind spot, like in my left part of my visual field, maybe with just my left eye, and then some paresthesia-like symptoms
On the left-hand side,
radiating.
especially when I asked you to clench for some of the tests.
Yes.
It made it really worse. And then I just turned on the ultra low frequency tense, and it's just amazing to you, huh? Huh?
It's unbelievable.
Well, good, good. We're just starting, but I just want to record that because it's so real, your response. What are you laughing?
I've never felt this good in my life. Oh, it's been fucking pain.
All right, good. It's hopeful. I'll do the
We started
turning.
an hour before this. It was totally locked up, 0 degrees.
Don't help me or fight me. I'll do the turning. Don't help me or fight me. I'll do the turning. 80.
Well, I just felt something in my left ear.
Okay. Got 80. All right. You were telling me something, Kyler, when we were doing the tense. So you felt some changes. Tell me about them. What did you feel?
Almost instantly, I felt a regain of my vision, my visual acuity.
What do you mean?
Like there wasn't any of the haze, the auras, the just.
Do you have it all the time?
Yeah, it's like a fog, like both a cognitive fog and then a visual fog. That
What do you mean by visual fog?
just you don't, when you look at somebody, you don't get all the detail. It's
Huh.
like you're literally in a haze. Like there's
Like a film or something on your windshield?
and it corresponds a lot of times with some sort of migraine headache that's usually on the similar side of where the visual person.
Does it ever get clear normally?
It could be transient sometimes and go back and forth, but 95% of the time it's there.
How many years have you had this?
Probably for at least, shoot, 8-10 years.
No kidding. So you're kind of used to that?
I mean, you get used to it after a while when you wake up. And
And how do you drive and stuff?
it's a good question. You're always looking around and stuff. And
Okay. So I know you got emotional when that happened. So, but I didn't want to stop right then, so I thought I'll ask you after that. So that's one thing you notice. You notice other things too. Something about a numb feeling getting better.
the numbness and paresthesias I've been experiencing were going away, and it was pretty dramatic. It felt just, and one of the other major things was the airway opening. Just before I came here, you know, with all the sleep apnea and stuff, always just breathing, normal breathing felt constricted. After we did the TENS unit and during it, I felt literally the airway opening up and that tension being relieved and that secondary anxiety just being eliminated. And it was a very liberating experience. Almost like using some sort of powerful drug or something.
I know you're saying, like, what are you guys doing?
I mean, it was unbelievable.
Okay. What else? You also noticed facial pain or facial something loosen up?
Yeah, when we first put the TENS units on, had a lot of sharp pain, and then it just started going away. And as it went away, the symptoms were going away.
What symptoms?
The visual problems, the migraine, the paresthesias going on my arms and my legs, just all the sensations I've been describing. The dizziness, the vertigo. It was
I know you got emotional there for a bit. You know, I guess you don't mind saying that you started weep.
I started crying, yeah.
Yeah, and
I
you
couldn't
said
believe it. I couldn't believe like you could feel that good. I always thought this was life, and that's what I guess my family sort of reinforced. You know, every time I woke up and felt horrible and didn't want to go to school and kept having problem after problem build up, I thought this is the way to live life, and I thought that was going to be my future. And then when this stuff happened, you know, this year and got in an accident, I thought I was going to be disabled, and my parents were actually willing to accept that because his dad has fibromyalgia.
Did I
That's
hear
normal.
that you're encouraged to go ahead through the disability process?
You know, my dad just finally threw up his hands and said, you know, he didn't know what to do. He didn't have answers, so he just
Well, neither
went
did.
to the knee-jerk response from the doctors, which is some sort of psycho-somatic anxiety or.
Well, you had about almost 30 doctors, you said? 30 different doctors over
30
years?
to 40 doctors.
That many?
Have seen me, from everything from CT scans, brain MRIs, to advanced blood work, multiple secondary opinions on most of these issues, and nothing came consistent until there was at least a diagnosis of the symptoms, which was fibromyalgia by one of the best rheumatologists in Dallas. And then after...
So this is a rheumatologist that gave you the diagnosis?
Yeah, the orthopedic surgeon that I've been seeing for several years, he's pretty good. He, after seeing me again for some of these complaints, he finally just threw up his hands and said,
What's the doctor's name?
The orthopedic surgeon, Virendra Patel.
And why were you seeing an orthopedic surgeon?
At the time, for two different main complaints. One was the arm paresthesias that kept coming on, and he initially thought it was thoracic outlet syndrome, even though the test for the thoracic outlet syndrome wasn't consistent with that diagnosis. And then he prescribed physical therapy for 6 months after that, and that I didn't even go through with that because I was feeling numbness in my legs, and logically, you know, arteries up here aren't going to relate to your legs. So I kept going through more diagnostic testing, and then I landed ended up coming back to him for after an ER visit for horrible cervical spine pain. It felt like somebody was literally severing my cervical spine, somewhere, one of those discs. It's like somebody's cutting it. It was so bad, and it locked up like this while I was driving after I hit a bump, and I went to the ER. But anyways, he looked at it and had a spinal MRI done, and he's like, there's nothing. He's like, you just got minor disc wear and a disc bulge, but there's nothing that can be correlated to your symptoms. And I was just shocked. And then he's like, you need to see a rheumatologist immediately because you either have rheumatoid arthritis or fibromyalgia, but probably fibromyalgia. And I didn't even know what fibromyalgia really was. And then the next day I was at one of the best rheumatologists in Dallas. And
who's that?
Dr. Jack Vine. He's a part of Rheumatology Associates, and everybody knows him in the Dallas area. He's extremely thorough. And after spending a good amount of time with me, he diagnosed me with fibromyalgia, which I think was the most appropriate description of my symptoms with that in that practice. But after just studying this stuff and going forwards and backwards over the sleep apnea diagnosis and trying to correlate everything together, I came to the conclusion that it was a TMJ issue.
Well, TMJ is a little too limited. I just want to kind of hear from you how you felt during the thing. Really, fibromyalgia and all those things are their way of looking at things. And
Right.
obviously, that's why 40 of them didn't come up with anything different. We look at things differently in terms of functional physiologic alignment. It won't make any sense to them.
Right.
But I just wanted to find out about, you wanted to say a lot. You even wanted to get on FaceTime with your parents right then, but I couldn't stop right then. Thought I'll give you an opportunity to tell me. You're smiling really easy now.
It's so much better to smile. I don't feel all this tension and stuff.
Can you open wide? Can you open your mouth wide? Earlier it was hurting.
Earlier, I mean, just the pain, the facial pain, the tension, you can see it. You can see my muscles fighting.
Quivering.
The battle. And it looks almost like I have anxiety or something. You know, you think somebody that's in an intense, stressful situation, their muscles are going to... But this is 24/7, so that can't be a possible explanation. And so as soon as I read the information on your website and stuff, I was thoroughly convinced that, and watched a few,
Well, I'm glad you didn't give up on yourself.
and then started doing...
Let's see how we solve this puzzle.
All right, thanks, Tyler.